Guys, welcome back to Medical Coding with Blue. Today's episode is all about the pros and cons of working remotely in medical coding. If you are brand new to my channel, welcome. I am Blue, I'm a medical coder. Okay guys, working remotely. A lot of people get into the medical billing and coding field because they tell me, Blue, I want to work remotely. And that's the first thing they say because that's what's attracting them to this particular industry. And it pays well, and they want to be able to take care of their kids. But here's the thing. When you work remotely, employers are going to assume that because you are at home by yourself, that you are not going to have as many distractions as if you would have if you're going into the office. So in the office, of course, there's going to be expected disruptions during your day, whether it's from your other coworkers or, systems going down or whatever. Now, systems do go down when you're at home, but there's other things that they do. They have other contingency plans for people who work remotely. Now, when you are working remotely and you are at home and you are thinking this is going to be the greatest thing ever, and you're a brand new medical coder, the problem happens when you get into the electronic medical record, because it's not just that you're learning brand new how to code from charts, but you're also having to learn a whole electronic medical record system. And when you have to learn that, there's so many things to it. It's not just, oh, you go here, go there. There's training that is involved with these electronic medical records. And every electronic medical record system is different. There's Cerner, there's eClinicalWorks, there's Epic, and even Epic can be different from place to place because with Epic, they have different packages for the amount of patients that that particular facility has, or however big the population is that they care for at that particular place. It's going to be different. So you just have to be ready to learn those things. And it's a little more difficult when you're having to learn remotely because you're not going to have somebody there with you. And a lot of times if you are having a question or you're needing help, you have to type it into a chat. And that can be difficult because if you don't quite know how to word the question, or maybe you get flustered and you're just like, I don't know how to say this, I don't know how to word this, it just makes things a lot more worse when you could have just been in the facility for a little bit to get that training and then go home. At least that's what I always recommend for my brand new people. Now, before the pandemic, if you did not have experience, you were not getting a job at home, period. But since the pandemic, a lot of companies have learned that, coders can be brand new and work at home. And, we can allow for those things. So they do it. But now that, we're coming out of it and there's a lot more demand on people to be not just credentialed, but also to have experience. Now, if you say, well, Blue, how am I supposed to get experience if no one will hire me? They will hire you. And I've gone over many, many episodes on how and where and how do you get going. I've said it so many times, guys. I have 1,100 videos on my channel. You can find something about some tips, okay, and when it comes to that. But when you do consider yourself very lucky to get hired remotely and you're brand new, take it very seriously because rest assured that every single new person that gets hired, employers are looking at, right? And they're looking at you to either confirm what their suspicions are, which is, new people, they just want their hand held, or they want to work at home so they can goof off. You want to make sure that you're taking it very seriously and that you're doing your work in the time that you are assigned to work. There is no working off the clock to make up the time. There is none of that, all right? So take it seriously, all right? And the other thing is when you are working remotely, you have to be in an area in your house that is secure. You have to securely connect to the internet. There is no connecting to Wi-Fi willy-nilly. Oh, let me go to Starbucks and have a breakfast coffee and then just be able to do my work there. It's not that way. Because again, you have to be connected to the internet securely. Your computer setup has to be, your monitors have to be facing a wall and only where you can see them. No one can be behind your back looking over your shoulder to see what you're looking at because it's a HIPAA violation if anyone else but you sees what's on these screens. Now, if you have teenagers in the house, it doesn't matter. I mean, they could see something or see somebody's name, and then all of a sudden they're telling everybody their business. And you wouldn't want that, right? For you in your records. So make sure that whenever you do work at home, that you are securing those screens so that only you can see them and no one can pass by you and look over your shoulder and see what you're doing, all right? And that you are in a place where you're going to be able to connect to the internet securely. A lot of people are under the misconception that, oh, I can go down to the beach, or I can be in an RV up in the mountains and doing this and just connect to Wi-Fi. It's not that way, guys. It's not that way. And for a lot of people who will disagree with me, I will tell you this. Being that I have worked at home twice already, in pre-pandemic, post-pandemic, I've done it twice. And I know. And there's a lot of people that think that they know and they don't know because they're not in our industry. We have to protect patient health information. And this is private information. There are laws that protect this information. Now, I'm not saying this stuff to scare you out of working at home. For some people, they have a long distance to travel in order to be able to get to a location to work at. So it just makes sense for them to work remotely. And that's okay. You know, if that's one of the reasons, it's a pro, obviously, to be able to work remotely. Because, you know, that long distance travel and stuff like that, just in order to get to work is sometimes a lot. So being able to have that flexibility to work at home is great. But again, you have to take it seriously and you have to be prepared to do your research on your own. You have to be able to learn to problem solve as you need to. There's not going to be somebody there to bail you out. You know, it's a lot easier when you're in person, obviously, to get your questions answered. But when you are by yourself, you have to really kind of get creative with some of your problem solving. And so that's just something that you have to know and be prepared for when you are working remotely. One of the other nice things is if you want to wake up not early, but just right on time so that you can log in and you're ready to go. That's always a nice thing, right? There's no threat of being late and you could just start your day, you know, and that's totally okay. But I will say that working remotely, and some of the downsides of working remotely, is that it does get lonely. It gets very quiet. It is very difficult to create those relationships with your providers, to help them if you have to query them, and especially if you have to submit a lot of queries. I don't like to submit a lot of queries, me personally. What I do, even though, because I'm in the facility, right? But if I tell my providers, if I have to send you more than 5 queries, I'm coming to your door. I'm knocking on your door and I'm finding out what's going on because I shouldn't have to send you 5 queries. I shouldn't. And it's either going to be an education issue or it's going to be a communication issue, because that we don't do that. We don't do that here. But you have to be queried if it is appropriate. But if you're missing something, then I need to come and talk to you, you know. And it's very difficult to do that when you're remotely, because what are you going to do? Email them? And after a while, providers will happily ignore your emails if you are sending them excessive amounts of emails that they feel is excessive. And 3 could be excessive to them, you know. So you just never know, because you're not in the facility to make those relationships happen, right? So it's a little bit harder when you're working remotely to do those things. And if you say, well, Blue, I'm not really into like the whole being around people. I'm okay to be by myself, and I'm okay to be in my own little bubble, and I can avoid all the drama. You don't really avoid the drama, though. From what I have learned working at home remotely, is that drama can be just as bad as if you're in person, right? The only thing is that, you know, they're on the like the messenger tab, and you know, you can see them there. And then of course they do have meetings, and meetings are a little bit more meaningful when you are working remotely, because that's the time for everybody to get together and have questions answered. But then of course you're hiding behind a camera or you're hiding behind a keyboard, and it's a little bit easier sometimes for some people to get a little sassy. So that's why I say you don't really miss out on the drama. The drama is still there. When I worked for a level 1 trauma hospital, that was part of the deal too, was I didn't have any issues with a lot of the people because I worked in the evening. And so that was okay for me because it was nice and quiet and I didn't have anybody to message me, but we did have some supervisors. One supervisor lived up in Alaska. So that was interesting, but she would be on when I was on in the evening, and she would occasionally ask me questions, and that was okay. It was a good thing to kind of break up the evening, so it was all right. But at the same time, when you're working and everybody else is on, you're fighting in the queue. A queue is like a whole list of all the patients that were seen, and the way that it worked when I worked for a level 1 trauma hospital was we had to go in there and we had to select a record, and then if you're in it, nobody else can get in it, so they have to go to the next one, and then sometimes that record's taken, so you have to go down a few. Well, what ends up happening is sometimes coders end up skipping, and that is really prevalent in remote jobs, is that they'll skip. Now people will ask me, what do you mean by skipping? Just what I said. You have a whole list of patients, right? And if you don't want to do this one, you're going to skip over it, right? You're going to go down to the next one or the next one or, whatever. And that's skipping. You're not working in order. You're just going and you're jumping from another record to another record, whichever record you think is easier, right? So that happened to me. A lot of the coders did that. They skipped during the day. So by the time in the evening when I would come on, I would see that there was a lot of really hard and difficult charts, and that happens when you're working remotely, and it's because people don't have those relationships, so they don't know who they're really kind of messing with, as far as like, okay, well, who cares? I just know I did my productivity. I don't care about anybody else. That happens. But working some of those harder charts, of course, made me a stronger coder because it's just what you do. There's going to be times when, yeah, that does really stink and it's bad that your coworkers do that to you. But at the end of it, I came out stronger because there's really nothing that I can be exposed to that I would be afraid of. And whereas I know that there's other people that are very limited to what they can do and where they can go because they have chosen to limit themselves, mentally, as far as like, oh no, I can only do like gastro. I can only work in the gastro clinic because that's all I know and I don't want to learn anything else. I would never want to be that way. I would never want to just only limit myself to a particular specialty. There's a particular specialty that I love, of course, podiatry and orthopedics. Of course, I love those, but I'm always willing to check other things out, in the meantime, in between time, because you never want to get rusty on the other specialties, so I'm just saying. But that's some of the shenanigans that coworkers will do to you when you're working remotely because they don't know you, right? And then even if they do get to know you, they get to know you through Messenger and things like that. And a lot of times, like, they wonder like how to keep up the camaraderie when people are working remotely. Well, when I worked for the Level 1 Trauma Hospital, they were fantastic at keeping up with people and building that camaraderie, even though we were all remote. So what we would do in meetings is sometimes we would, go around the meeting and we weren't doing Zoom yet. It wasn't like Zoom or anything like that. It was just over like WebEx and things like that. So that's what we would do. And we would introduce ourselves and we would say something about ourselves, and that's how we all got to know each other. Well, then this was during the time where we were going over the ICD-10 CM changeover, and how they kept us all motivated was they would send us little things in the mail and things like that. And just that's part of remote work life is that you get that distance. But you get when you get those little notes and things like that, there's nothing more touching than getting a handwritten note, right? That means somebody took the time to write to you and write a few words or whatever and send you something in the mail, right? And so when you are at home by yourself and working alone, when you get something like that in the mail, it's nice and it keeps you motivated. At least it did for a lot of us, because it was a very nice gesture, right? So that's just one of the things that you want to look for, the kind of culture you want to look for if you're working remotely. And that's something that you can ask, what is the remote culture like? Are there those types of things? Do we have those types of meetings? When I was at the conference this year in Baltimore, AHIMA 23, one of the classes that I attended was how to keep coworkers motivated when they work remotely. And one of the ladies that was speaking, she was saying that they have a book that they use to kind of help to bring remote workers together. And that's something that is a psychology behind it too, because if you are by yourself and you're not around people, it can affect you after a while. Like, you feel kind of isolated and things like that. So how do they keep people motivated? And so what they would do is they would say, okay, well, we're going to do afternoon tea. So they would send everybody on the team a little tea bag, so that way that they could have tea together, afternoon tea. And they would send them like little cookies from like the vendors, whatever. And they would do like Cheryl's cookies, something like that. It's not an ad for Cheryl's cookies, but I've gotten a Cheryl's cookie before, and those are pretty tasty, So they send those out, and people just enjoy their little snack and their warm tea, and they kind of visit with each other, and they do all kinds of games and stuff. And so that's just something that you can ask when you're looking to work remotely. You want to work in a place like that. Some place that is going to be consistent with that positive culture, because again, it does get lonely, and you do feel isolated after a while if you're not connecting with people. And the important thing when you're working remotely too, this is not a pro or a con, but the important thing when you're working remotely for yourself is to dress up like you're going to the office. You don't have to get all glammed up and everything, but at least dress up where you're comfortable and you still feel nice, because your mind does need that. Your mind does need to have that structure, because otherwise, you can say, well, I've been wearing the same sweatpants and sweatshirt all week and not really doing anything for yourself, and it does kind of wear on you after a while, and it can affect your productivity and it can affect other things. So it's just something that you have to kind of keep up with. When it was the pandemic and we were working remotely, I got up, I got dressed, I did all my morning routine, and I would pick out a dress and I would sit there in my dress, and it didn't matter the fact that I was there in the room by myself, but I would do that. And then whenever we would talk or whatever, people would say, oh, I'm so glad I don't have to get out of my sweats. And I just can't imagine. I can't imagine just being like whatever and trying to work, And so that's just, it's just a personal thing, I guess, but it's just something that you got to know, especially if you've never worked remotely. It's not as romantic as a lot of people try to make it out to be, these schools and the people who sell these programs. It's not as romantic as they try to make it out to be. It really all depends on the individual. You really do have to make sure that you're getting outside, that you're going outside and getting sunlight and sunshine on you, on your skin, getting some fresh air, because otherwise it's very easy to just stay inside all the time. One of my supervisors that I had when I was working remotely for the Level 1 Trauma Hospital, she had parked her car in the driveway. She lived in this neighborhood that had a neighborhood, what is homeowners association, and they put a thing on her car that it was an abandoned car because it hadn't moved. And she's like, I work remotely. I don't have to go anywhere. And so they're like, oh, we didn't know that, because she hadn't moved her car in a week. And so she says that she has to make that conscious effort to move her car, because otherwise people will think that she's just not there, or the car is abandoned or whatever. And it's the same thing for you if you decide that working remotely is what you want to do. Make sure that you still have a social outlet. You still have a social network. Whether it's if you go to church, going to the church. If you go to the public library, just anything to be around people. You still need to be around people. And a lot of people say, well, Blue, I'm introverted. I am an introverted person myself. And I am very shy, believe it or not. And you might think, well, Blue, no, you have all these videos and you do YouTube and all these things, but by nature I am. It's just that when it comes to the coding, I get very excited, and then plus I want to help people, and that's part of what brings me joy. So I come out of my shell when it comes to this, but normally I am very shy, so, but it's very important that for your productivity's sake, for your overall enjoyment of working at home, if you want to continue to enjoy working at home and you don't want to get bored and you don't want to get lonely and you don't want to feel any of those feelings, make sure that you still have an outlet. Whether it is that you go to a Starbucks and get a coffee or anything, just to be around people, okay? I think a lot of times now we are losing as a whole, humanity, we are losing a lot of that connection with others because of the ability to be able to work remotely, and we can be around our family and be around each other and things like that. Well, yes, but your kids are going to grow up and they're going to go off and do their own thing, and they need to be able to be social and meet other people. And it's the same thing for you. You have to be able to do that, and you have to be able, it's just in our human nature to be able to do that, whether you are introverted or extroverted. It's part of what we do, is part of being healthy and living a balanced life, and that's just one of those things that you got to think about especially when you work remotely, and I would encourage you, if you work remotely, to make sure that you attend the chapter meetings if you're with AAPC, or even if you're with a HIMA. A HIMA is a little bit harder sometimes because for us, I think we meet quarterly. I don't know, I seem to hear about it at the last minute. But if you are in a place that has like AAPC meetings and they do them quite frequently, make sure that you're attending those, okay? Because even working remotely, it never hurts to build a network of other medical coders that you can connect with. So that way, if you have a question, you're not running back and forth to your boss. You're not running back and forth to your coworkers. You're reaching out to others who you may be able to learn more things from, right? Yeah. So, that's just something that it would be my suggestion anyway. There's pros to it, of course, the peace of your own household, being comfortable and not having to have nosy coworkers around you, and, the ability to be able to close that chat, whenever you want to, and, that kind of thing. But, the downside of it is it can be lonely. It can be lonely. It can be very boring. And a lot of people don't think about that until they get in it. And then they're like, I see what you mean now, Blue. Yes, I know what I'm talking about because I've been there and I've done that. Got a t-shirt. The first experience that I had working at home remotely, it was a good one because, like I said, the culture there at the organization was, we still want to keep our workers connected even though we are far apart. And we're going to look for creative ways to do that. And so that was a really great part of it. The second time working remotely, when it was a pandemic and I just couldn't stand it. I could not stand it. It was not good for me at all. And I did not enjoy it. It really severely impacted my productivity, and to the point where my boss was like, what's going on? Well, are you okay? I'm like, yes, I'm fine. It's just that the system is slow. It's not my fault. And it's just like, you can't stay. I could not stay focused because it was so quiet. And I like my home to be my sanctuary. This is my sanctuary. So that when I leave and I'm going to work, I'm at work. And I don't want my work to be in my home, in my sanctuary. Now, this other stuff, this YouTube and Patreon and coaching and resumes, all that's something completely different. That's something that I enjoy, and I'm fine to do this in my home. However, when it comes to work and coding and things like that, I want that to be separated. I want to be able to go to a place and leave that place so that when I come home, I'm in my peaceful bubble. But that's just my advice anyway, guys. There's ups and downs to it, but the onus is going to be on you to take care of yourself physically and you know, with your mind and everything else. You know, it's something that you gotta really pay attention to. And if you find yourself like you don't know why you don't have energy, and all of a sudden you realize it's because you haven't been outside, make sure you go outside. And it's the same thing for even coders who work in the office. You know, coders who work in the office and who are sitting put all day long and not taking their designated breaks like they should, because they're trying to do a good job. You know, you're running yourself ragged and you don't need to. Okay, you want to make sure that you get up, get some sun, get out and get you some fresh air, because trust me, that sun and fresh air and the sunlight will do wonders for you. But you have to be present and you got to be with it, you know. So anyway, that's my episode for the day. It's not always what it's cracked up to be, guys, with this remote medical coding. And remember, it's a big responsibility, okay? But if it works for you and people are happy, that's great. But just remember that you always have to make sure that you keep up with everything else, and it's not just always work. You know, it needs to be you personally. Okay, I'm just saying. So with that said, I'm going to wrap this one up. Thank you guys so much for joining me. If this video helped you, please like, subscribe, and share, and I'll see y'all next time. Bye.